Hi, and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and today we're going to be delving into a hair transplant topic that is quite commonly asked and has to do with a different genetic kind of ethnic population that we don't see a lot of in Singapore, but we still encounter once in a while. And the question to be answered here is, can FUE hair transplants be carried out on patients with curly hair? Well, the answer is obviously yes, and that's because FUE has gone through so many iterations of change in the past 20 years. The punches and tools that are developed for curly hair harvesting are so advanced now that FUE can be done on patients with curly hair, and you'll see patients that are of African descent that have very, very curly hair. So how their hair looks like under the skin is it really looks kind of U or C-shaped, and the hair follicle punch that is straight will never be able to harvest the entire graft directly. Some people counter this by using larger punch sizes, 1.1 millimeters instead of the standard 0.8, 0.9. But there's also punches that now do specific actions such as slight oscillation to dissect out the tissue rather than spinning rotational cutting actions. There are also punches that are able to detect the curvature of the hair and do smart punching, so they incise the skin at the very surface, and then as it goes along the graft, it starts going through a rotational and vibrational motion. And these new generation of smart punches have made FUE for curly hair patients a very successful event. So it's important at this point to differentiate curly hair that looks outwardly curly versus afro curly hair, because afro curly hair is at the pinnacle of challenge when it comes to FUE. If you're not familiar with the topic, I suggest that you go to somebody that really has a lot of experience doing afro curly hair, because the technique is very different. You're gonna do very shallow punches very slowly and then use 3-step forceps extraction in order to get the entire graft. And we use a alter or a FUE punch here called the War system, which assists us in extracting curly hair. Now, there's a distinction between that and the curly hair of, let's say, someone of Indian origin, or the curly hair of someone who is Caucasian origin. They might have curly ginger hair or curly black hair. Usually the hair follicles under the skin are a little bit curved, but they're not U-shaped or C-shaped. And in those cases, usually the technique that we adopt is that we stretch the skin quite a lot after we've done the shape. And when we stretch the skin, we're also putting a bit of traction on the hair follicle to be a little bit straighter, allowing us for fewer graft transections. Most of our curly hair patients that we have done FUE transplant on fall into the latter group, not the afro hair group. The afro hair group really requires specialized equipment and a lot of experience in doing curly hair transplants in order to execute them well with a high survival rate. The other aspect of curly hair FUE is the implantation step, where you have to ensure that the curl of the hair are all consistent, so that when they grow consistently. If not, you're gonna have hairs that curl in different directions, and that's gonna look a little bit awkward if it's across the hairline. Certainly if they keep it very short, that's okay, but when the hairs start to grow out, they might grow in awkward directions all over the place. So to answer the question in short is, can FUE be done on patients with curly hair? Yes, FUE has developed into a practice that can be done on patients with even extremely U-shaped or C-shaped hair curls under the skin. If you liked our content today, click like and subscribe. Any questions that you may have on curly hair FUE hair transplants, do leave them in the comment section below, and we'll see you in our next episode.